HIPAA privacy, how it affects you. The purpose of our in-service today is to increase our knowledge and understanding of protected health information and to enhance our awareness in our role as a RHIT in helping this facility follow the HIPAA rules. What is HIPAA? HIPAA is the Health Insurance Portability and Accountability Act of 1996. Key terms for HIPAA: privacy, use, disclose, authorization, PHI, and minimum necessary. Use: individually identifiable health information, sharing, application, utilization, examination, or analysis of such information within an entity that maintains such information. Disclose: to release or divulge information by an entity to persons or organizations outside of that entity. Authorization: the mechanism for obtaining consent from a patient for the use and disclosure of health information for a purpose that is not treatment, payment, or healthcare operations. PHI, protected health information: all individually identifiable health information and any other information on treatment and care that is transmitted or maintained in any form or medium, such as electronic, paper, or oral. Minimum necessary: when using any PHI, a covered entity must generally make reasonable efforts to limit itself to the minimum necessary to accomplish the intended purpose of the use, disclosure, or request for PHI. In simpler terms, that means when you are on the phone or talking to someone in person about the release of medical information, whether it's theirs or whether it's a doctor's office requesting information about a patient, you only give them what they need, the minimum necessary to accomplish the purpose of the use and disclosure of their request. Identify protected health information uses and disclosures. Who? People who routinely use or disclose or receive requests to personal protected health information in our facility, such as an RHIT or someone who works in medical records and receives requests for medical records release. HIPAA enforcement: there are criminal penalties for failure to comply or knowingly or wrongfully disclosing or receiving protected health information. These penalties apply to oral, paper, and electronic protected health information. Establish or appoint a compliance or privacy officer to develop policies and procedures to safeguard our public health information. We have a privacy officer in place. We can go to them for questions about security, about disclosures, about breaches in any of our medical management records. Where do we find protected health information? We find it in the medical records department. We find it in the billing department. We find it in insurance and benefit enrollment plans and payments. We find it in claims adjudication. We find it in case or medical management records. Remember, again, it exists both paper and electronically. The following are some examples of protected health information: the patient's name, their address, their date of birth, their admission date to the hospital, their discharge date, their date of death, telephone numbers, fax numbers, electronic email address, their social security number, their medical record number, their health plan beneficiary number. Any unique identifying number or characteristic is an example of protected health information. Who is affected by HIPAA? We as RHITs who handle, use, and know individuals' protected health information. Healthcare providers, hospitals, doctors' offices, or any agency that transmits protected health information electronically. Insurance companies. HIPAA also applies to us as a consumer of health care. How can we, as RHITs, protect personal protected health information? Never discuss personal protected health information where others may overhear. Never leave your medical records where others can see them or access them when you're working on them or when you walk away from your desks. It should never be viewed or shared in public areas. Never leave it exposed in mailboxes or in conference rooms. Never share your computer password or leave it visible. You need to return your medical records to the appropriate location. If you're searching, say, in a paper chart for something, you need to return it back to the proper place. Dispose of any paper or documents containing personal protected health information properly. If you're finished with it and have no more need for it and it can be shredded, place it in the shred bin. And only fax according to the center's policy, and make sure you have the correct fax number, and ask the person you're faxing to send you confirmation that they received the information. What are the need-to-know principles? The need-to-know principle is that information necessary to perform your job. How much do you need to know? And how much do other people need to know, such as a doctor's office requesting PHI? HIPAA has minimum necessary rules. Minimum necessary does not apply when a patient provides a valid, signed authorization for release of PHI. The exceptions to the rule are disclosure to a healthcare provider for treatment, permissible uses or disclosures made by the patient, and use for legal proceedings or law enforcement. HIPAA requires a notice of privacy practice to be given to the patient and signed. It must be provided at the time of first service or assessment for eligibility. They also need privacy officer contact information. Consumers can request that the facility restrict how we use and disclose their PHI. We are not required to accept the request, but if it is accepted, then we need to follow it and never deviate or depart from that restriction. Patients can access their personal health information. They can inspect it. We can give them copies of it, but the request must be made in writing. We must verify that the person or agency requesting the PHI is who they say they are, and we must document that verification. There is a complaint procedure in place if a consumer feels that we have improperly used or disclosed their PHI. Inappropriate access, use, or disclosure of consumer PHI results in disciplinary action and other penalties. Some examples of when no authorization is needed is in cases of child abuse and neglect, judicial administrative proceedings, law enforcement, and to avert serious threat to health or safety. We must safeguard consumer records. Share only the information necessary to do the work, and they have to right to ask about the use and disclosure of their medical records. Privacy and security. We need to change passwords. We need to have passwords and memorize them. We need to remember about system access. Never leave our computers open so that others can log on after us if we walk away. Our role as RHITs will dictate our access to PHI. We need to remember security and privacy and only access what we need in order to do our jobs.